So we're going to talk about flashers and floaters in neuro-op. And normally the flashers and floaters is clearly not neuro-op because that's retina. The key and differentiating symptom that would make you worried that it's neuro-op is bilateral and simultaneous. And we need those words in the history because almost never is retinal disease, like a retinal detachment or a vitreous hemorrhage or posterior vitreous detachment, all the normal causes of flashers and floaters, going to occur acutely in both eyes at the same time. If it is bilateral in the retina, it's normally sequential. I had flashers and floaters last year, now I have flashers and floaters this year, and I had a posterior vitreous detachment or a retinal tear that was fixed by retina. If it's bilateral and simultaneous, that is the big red flag that this could still be neuro-op. The second thing is you're going to be looking at the sign, and that means looking in the eye. And of course, if it's normal, that's actually a big red flag. If we don't see the PVD in both eyes, if we don't see the retinal detachment in both eyes, that means whatever it is, it's not in your eye. But paradoxically, it's also dangerous if the exam is abnormal, because you're going to be tempted to get premature closure to differential. And if you see a PVD, a posterior vitreous detachment in one eye, but you don't in the other eye, you might blow it off and say your flashers and floaters are from your eye when it's not your eye. So one of the questions that you have to ask with these floater people is, because a floater is in your vitreous, the way that people get symptomatic from floaters is entoptic phenomenon, and that means the light has to hit the floater and cast a shadow onto the retina. So what they see is a floater. If you close your eye, it'll go away. So if you close your eye and it stays in that location, that's cortical. You cannot use that for the flasher. So you need to know that flashers and floaters that are bilateral and simultaneous could be cortical, whether that's migraine or seizure or TIA. Those are very bad things in the differential diagnosis. The symptom, bilateral simultaneous, does not resolve if you close your eyes. The sign, it doesn't matter. Now, you do have to look for papilledema and things that would help you make sure it's not pathologic. But even if it's normal, that's also a red flag. And the dangerous thing, you might be drawn to a red herring and call it intraocular entoptic phenomenon when it's intracranial.